Thank you for virtually joining us as we review the latest situation regarding COVID-19. My name is Aditya Luthra, Security Director for International SOS in our Singapore office, and I'm very happy to be joined today by Dr. Mark Parrish. So together we'll be reviewing the latest updates regarding the outbreak and review the challenges organizations are facing when supporting their employees when they're outside of their home country, what may be referred to as international assignees or expatriates. So before we look into those challenges, I'd actually like to pass it over to Dr. Mark to share some of the current status of COVID-19 and the significant changes that we've seen over the past week. Dr. Mark?
Aditya, thanks. And hello, everybody from London. 6th of April today, we've seen a continued spread of COVID. It's moved westwards across the world, hasn't it? Starting in China, Asia, Europe, now in the USA. We've got more than 1 million cases. But just be aware that don't read too much into that case number, because the case number depends upon how much testing countries are doing. And one of the things we have seen is that different countries are testing different populations. Some are testing vast numbers of people in the community. Others are only testing those who go into hospital. And therefore, the case numbers that's reported are probably very underrepresented of true case numbers around the world. We're now seeing an increase in cases in the United States, and that's likely to continue for the next 2 or 3 weeks. Whereas in Europe, in countries which have seen a significant number of cases and of deaths, particularly Italy and Spain, that have been reported in the last few weeks, there is the indication that that might now be flattening out. Other countries in Europe, particularly in the UK, still seeing deaths increasing, and that's likely to be the case for the next week or so. Linked into that is governments' reactions to managing the outbreak. We've seen a variety of different amounts of restrictions, of isolations, of lockdowns, call them what you will. They vary from country to country. You'll all be aware of what is happening in your country. The other thing that we are seeing is this increasing discussion about testing, not just testing for the disease, for the virus, but also testing for the antibodies, the immune response that happens in our bodies. Because if we can start to get an idea of those of us that have those antibodies, we can start to understand just the sheer impact of COVID around the world, how many people have been infected, and therefore how many people may be immune, and we can start getting people back to work. I think we'll see more on that in the next few weeks as governments start to deal with those challenges. And as this pandemic evolves and travel restrictions become stricter, obviously it poses health and security risks that need to be very proactively supported. Aditya, could you take us through the first implication that we see organizations being challenged with?
Yeah, thanks, Dr. Mark. So I guess the first point that I want to highlight are some of the restrictions that you've actually talked about to mobility specifically, both international mobility as well as within countries. Now, I don't want to spend too much time on the international travel restrictions component. By now, a large number of our client organizations, they've already made the decision or have been forced to make the decision to defer non-essential travel. And then for essential travel, they're implementing a case-by-case approval process. But I guess just for context and to reiterate the point that you made earlier, the vast majority of countries have implemented a range of restrictions on international travel. And these bans are usually based on the place of issuance of the passport or the visa, as well as bans based on the origin of the trip or the travel history of the individual traveler. So if you've been somewhere in the past 14 days, you aren't actually allowed to enter the country, or if you are allowed to enter the country, you're put under a quarantine for a significant period of time, or the 2-week time frame. But what I did want to focus in on was the component that I think is actually more relevant for an organization's international assignees, their local nationals, their domestic workforce, and that is that the majority of countries continue to impose significant domestic restrictions. And these domestic restrictions range from things like curfews, mandatory closure of non-essential businesses, lockdowns, and in some places, shelter-in-place orders. And like restrictions on international travel, these domestic restrictions are expected to remain for an extended period of time. But what I think is different in these domestic restrictions from international travel is that the nature, the duration, the enforcement, and the impact of these local restrictions are a lot more fluid, and they're going to reflect the localized conditions on the ground. So countries will escalate, de-escalate, or re-escalate their restrictions based on where they are in that pandemic curve. So, for example, you just now were speaking about some of the restrictions and some of the case volume in the Western Hemisphere, and we're seeing that countries in the Western Hemisphere are just now escalating their domestic restrictions on mobility or at the peak of those restrictions. But there are places in Asia, China, for example, that are beginning to de-escalate their local restrictions. And then there's places like Singapore, where I am, and Hong Kong, where we escalated early, we began to de-escalate, and because of the second wave that we're now facing, we're seeing a re-escalation in those restrictions. So I think from an organization's perspective, they're faced with this very harsh reality that movement of their individuals, in-country individuals, could be a challenge, and the priority actually needs to shift into ensuring their health and safety and security in this environment. And with that, like, I would, the implications I would pass back to you, Dr. Mark.
Yes, thanks, Aditya. The other important point, of course, is the ability for healthcare systems to manage when they have this increasing demand with COVID-19 cases. And we see this even in countries, with very high standards of care, because of course, other healthcare conditions haven't just stopped. So whether you may or may not have COVID-19, you may have a number of other healthcare issues which require some support and some access to the healthcare system, whether it be with a general practitioner or be with going into a hospital. And with this increasing spread of COVID and increasing numbers of cases in countries and cities, it's pretty important to understand, how that's going to affect the ability of companies' employees to get healthcare. Whether it be for COVID or for something else. So one of the first things that we're recommending is to use telehealth services. We've seen a massive increase in those in so many countries. Fascinating here in the United Kingdom, which has not been particularly far forward in using telehealth services. That has suddenly changed in the last few weeks, and bureaucracy has gone away, and we are now able to contact our healthcare professional very easily by telephone, by video conference, by a variety of other things. And similarly at International SOS, we're doing the same. We see a lot of advantage to that. A lot of care can be provided by telehealth. The second thing, which I think is really important, is to make sure that you're getting accurate advice and sending this to your workforce. Aditya, you and I talk a lot about the vast amount of, let's say, fake news or the slightly different information that we get from so many sources nowadays about COVID-19. Very important, making sure you've got fact-based information. I mean, you're not overwhelmed with stuff which is not correct. So organizations should be asking these important questions to plan for a potential worsening situation, and other things that do have access to medical supplies in the event that things deteriorate. Aditya, could you take us through sort of this increase in security risks for all these people living overseas?
Yeah, and that's a really good point. So one of the changes in the kinds of questions we're seeing asked by our clients is that over the course of the past, I'd say 2 weeks or so, organizations are increasingly recognizing that there are going to be second and third order security consequences. And that's something that we've been advising organizations as well. We've been closely monitoring these rise in potential security incidents associated with the outbreak of COVID-19. And I'd like to categorize some of the security concerns into short, medium, and long-term concerns that an organization should be aware of. Now, of immediate concern is the rise in xenophobic attacks against individuals from or perceived to be from countries with particularly high cases of COVID-19. Now, such incidents of xenophobia usually consist of, or primarily consist of, acts of low-level intimidation, verbal harassment. In certain cases, we've seen refusal to serve certain individuals at local businesses or at hotels, for example. Less frequently, though it has happened, are incidents of physical assault. Now, one of the questions I get asked is, well, are there any nationalities that are particularly vulnerable to such acts? And I think it really depends. So nationalities and ethnicities, like I mentioned, coming from cases where you have particularly high COVID outbreak is of key concern, but it's also in the destination what the local public discourse has been. So does the local public discourse categorize COVID-19 as being imported from a specific country? So in certain environments in Western Europe, we've seen it categorized as an Asian virus, whereas at the same time in Asia, we're seeing it increasingly categorized as a European import. So that will also affect the xenophobic attitudes that we're seeing in parts of the world. Now, more in the medium to long term, the spread of COVID-19 is likely to result in certain environments in a deterioration of law and order and the associated rise in crime, social unrest, wider political instability. Now, from International SOS's perspective, the countries that are most vulnerable are the ones where you have a weak public health system that struggles to contain the spread of COVID-19, and that in itself exacerbates underlying or pre-existing security concerns. Now, given the current logistical challenges in providing on-the-ground assistance, from an organization's perspective, timely decision-making, exactly what you referred to, Dr. Mark, timely decision-making based on access to accurate information, forward-leaning assessment, and advice is absolutely critical. You don't want to be in a place where you're caught unaware or you're left to respond to a security situation when the situation has already escalated to dangerous levels. Now, if I was on the ground or if an organization's on the ground and they need that on the ground assistance, it's essential that that organization have access to reliable logistical support. So that's making sure that your ground transportation, your aviation transportation, etc., their robust medical and security evacuation capabilities. And these providers should be able to navigate the particularities of today's very challenging operational requirement. So just with that, I wanted to conclude that, there are unique and new challenges that these individuals and these organizations are facing, and these challenges will evolve. They'll escalate, they'll de-escalate, and they'll re-escalate based on very local conditions, including where the country is on the pandemic curve. Now, organizations must make sure that they're making informed decisions around crisis management, business continuity, and ensuring a strong operational resilience throughout the current crisis, as well as ensuring timely return to work and resumption to travel as the crisis begins to ease. So with that, I'd like to thank you very much for joining us today in today's virtual update. As the situation continues to evolve, please do get in touch with us to receive our up-to-date information, advice, and assistance regarding COVID-19.
Thanks, Aditya.